Have you ever wondered how doctors piece together a complex puzzle when symptoms are vague and scattered, often feeling like they are pointing in a dozen different directions? Diagnosing a condition like lupus is exactly that kind of intricate detective work, requiring careful observation and a systematic approach. Doctors diagnose lupus by conducting a thorough review of a patient's symptoms, combined with a detailed medical history, a comprehensive physical examination, and specific laboratory tests. There is no single test for lupus, so diagnosis relies on connecting many clues to form a clear picture of the illness. The reason diagnosis can be so complex is that lupus is often called a great imitator. Its symptoms are incredibly diverse, can come and go, and frequently overlap with those of many other conditions, such as rheumatoid arthritis, fibromyalgia, and thyroid disorders. This means a doctor must rule out other possibilities and carefully identify a pattern of symptoms and test results that specifically points to lupus. They often use established classification criteria, like those from the American College of Rheumatology, as a framework to help them identify this specific pattern. To achieve this, your doctor will start by meticulously gathering your medical history, asking about the onset and progression of your symptoms, any family history of autoimmune diseases, and all current and past medications. Following this, a comprehensive physical examination will be performed to look for characteristic signs such as skin rashes, joint swelling, oral ulcers, or signs of organ involvement. Crucially, they will order a series of laboratory tests, which often include an anti-nuclear antibody, or a NA, test, anti-double-stranded DNA, or anti-DNA, and anti-Smith antibody tests, as well as blood counts and kidney and liver function tests, to assess internal organ health and specific immune markers. Understanding that lupus can affect almost any part of the body, doctors look for a constellation of symptoms and test results rather than just one or two isolated findings. The ANA test, while a very common screening tool, can be positive in other conditions, so it is just one piece of the puzzle. Subsequent, more specific tests help to narrow down the diagnosis. This meticulous process often involves collaboration between a primary care physician and a rheumatologist, a doctor specializing in autoimmune diseases. Ultimately, the diagnostic journey for lupus is a careful, investigative process that requires patience, open communication, and detailed information from you, the patient. By meticulously reviewing your symptoms, history, physical findings, and lab results, doctors can connect the dots and arrive at an accurate diagnosis, which is the essential first step toward effective management and improving your quality of life.